Joyce Gibb, and thank you for being with me today. I've pulled some recent articles about prostate cancer and surveillance and treatment, etc. So I wanted to talk about those today. The first one is omega-3 fatty acids used in men under surveillance for prostate cancer and from intake to the prostate tissue level. So what's surveillance mean? A lot of times now, instead of going straight to surgery, depending on what the Gleason score is and the stage of that, or the, whatever it should be for, if it's a low Gleason score, of course, it's less serious than a high Gleason score. So, but what they found was that omega-3 fatty acids can be beneficial in prostate health. So this is a study done in Canada, and Musa is the first author on this study. And this abstract talks about dietary omega-3 fatty acids and their protective effects against prostate cancer in experimental studies. So what they found was that they looked at prostate tissue, red blood cells, and diet. And there were 157 men diagnosed with low-risk prostate cancer who underwent a first active surveillance repeat biopsy session. So they were under surveillance, just kind of were monitoring them, and then they actually agreed, because they did have prostate cancer, to do another biopsy. So they used a fatty acid intake questionnaire and checked their levels measured in prostate tissue and their red blood cells. So what they found was, at the repeat biopsy session, 25% of the men now had from low grade to high grade prostate cancer. And they found that the amount of omegas in the prostate tissue correlated the opposite to what the prostate cancer's tissue staging was. So high amount of omegas, lower prostate cancer risk. Low amount of omegas in the prostate tissue correlate with a high prostate cancer risk. So what does that mean? Just take your omegas. High dose omegas should lower the risk of prostate cancer, especially in those men that have this called active surveillance, where they're just kind of watching. So that's the first one. The second part is from pathology. And this was from a study, controversial issues in Gleason scoring, and this was many authors on this study from Toronto, New Zealand, Brazil, Australia, Japan, Cleveland, Ohio, Switzerland, Houston, Texas, France, and Taiwan. So there were many, and they were trying to evaluate for the Gleason scoring what other things should they look into. And so maybe if you've heard of Gleason scoring, maybe you haven't, but Gleason's grading system has been used for over 50 years to prognosticate, or to kind of determine and guide the treatment for patients with prostate cancer. When somebody typically has a biopsy, many people think, oh, I'm just having one biopsy, but that's not the case. So the prostate tissue is divided in half, and typically there are at least 5 samples taken on each quartile of that. So 5 sections on one side of the prostate tissue, 5 sections on the other, and then a Gleason score is assigned. So there are 5 grades within the Gleason score, and so a Gleason score of 6, which is 3 plus 3, 3 on each side, is classified as a grade 1, and they have grade 1 through 5. So a lower Gleason score, of course, is better. And so when they look at that tissue, they consider it like indolent or idle if there's any tumors there. So if you have a Gleason score of 6 or under, it's a lot better news than if you have 1, 7, 8, 9, or 10. And so what they wanted to do was, I guess, during the Gleason scoring, if someone is assessed it's called specific issues addressed in a percentage pattern 4. So pattern 4 is a red flag. It can typically correlate with an increased reoccurrence. And so what they recognized was that that needs to be established. So the pattern 4 should be established on every Gleason scoring if that's what happens, if you're more than a 3. So that's what they came out of this one study with all those people. And they also felt that further research is needed to determine other types of scoring systems used for that. So the last one that I wanted to talk about too is through, let's see, evaluating, getting your PSA checked, because prostate specific antigen is what's evaluated as one part of the evaluation. So how often should you do that? So they always talk about on here, is there a potential link between the screening frequency and the choice of active surveillance for low-risk disease? And nobody's really previously studied that. And their aim was to investigate whether there was any association between prostate cancer screening and or previous negative biopsy among men on active surveillance. So remember, active surveillance is something that doesn't need done right away. There's kind of having the watchful waiting. And so what they found was 47% of the men with low-risk prostate cancer underwent active surveillance. Then uptake was associated with older age, very low-risk disease, more recent diagnosis, and absence of family history. And so what they found was, which, people, they do a lot of these studies, they found no evidence that screening frequency and negative biopsy influences Swedish men with low-risk prostate cancer. So this was from Sweden. So if you have any other questions about prostate cancer, treatment, surveillance, what's the Gleason score mean, things like that, I'd be glad to help you with your health. There are some other foods, etc., that can lower the risk of developing prostate cancer. Hormonal variations, which is like increased androsterone, which converts then to a 5-alpha DHT. That is more specific, contains prostate tissue. So I'd love to help you with your good health. And if you have any screening questions or any questions about your PSA and what can be done to lower that, we do have some supplementation and lifestyle changes that can aid in at least not having that increase. So let me know if you need any help. Thank you for being with me today. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.